My name is Dr. Ben Brown. I'm an obstetrician-gynecologist and a health policy researcher practicing here in Rhode Island. I'm speaking today on behalf of the Rhode Island chapter of the American College of Obstetricians and Gynecologists, otherwise known as ACOG. Rhode Island ACOG strongly supports H5609, which would enable doulas to bill public and private insurance plans for the vital services that they provide. Doulas serve a unique role in pregnancy care. They act as an advocate for pregnant and postpartum patients, helping with health system navigation, bridging gaps between patients and providers, and supporting patients as they seek the pregnancy, birth, and postpartum experiences they desire. Doulas are most often visible in the labor and delivery setting, where their continuous labor support has been shown to have numerous benefits for patients. I've seen the value of continuous labor support in action. I recall a patient I cared for during my residency. I'll call her Ava. She arrived on the labor floor fully dilated with intensely strong contractions. She felt unable to push without an epidural, but was in too much pain to position herself for the placement of the anesthesia. I sat with Ava. I held her hand. I coached her through some deep breathing exercises. And in a matter of minutes, she was able to relax and to self-manage her pain long enough to get the epidural that she desired. And minutes after that, she had a beautiful vaginal delivery. I can think of few experiences in my professional life that have been as gratifying as this kind of accompaniment in the birth process. But unfortunately, I, like my colleagues here, am not always able to spend hours at the bedside with a laboring patient. This is an important place where partnership with doulas can be critical for my patients. Working with doulas has meant that more of my patients are able to benefit from continuous labor support. It has meant that anxious patients are able to center themselves. It has meant that patients with long labors are able to stay strong through the end and have a vaginal delivery. It has meant that patients and their families are more empowered to raise concerns. But good policy doesn't rest solely on individual experiences of providers. And indeed, there are excellent data to underscore the benefits of doulas. At this point, my written testimony mentions the same Cochrane review that we already talked about, so in deference to your agenda setting, I'll skip the statistics, but I would have cited the same ones. Additionally, today, disparities in maternal health and mortality are at the forefront of our national conversation about pregnancy care. The staggering 3- to 4-fold difference in maternal mortality between Black and white patients is causing those of us in the field of obstetrics and gynecology to critically examine how we can do better for our patients. Ensuring that each patient who comes through the doors of our obstetric unit has an effective and committed advocate is one critical way that we can begin to address those disparities. Now, while doulas may be best known for their work during birth, they are also outstanding sources of support to patients during the challenges of new parenting. Doulas support new parents in establishing healthy and safe homes, provide advice and assistance in breastfeeding, and can advocate for parents and their infants when they need to seek medical care. Finally, in addition to being good for patients, doula funding is also good fiscal policy. Minnesota is one of 3 states that already provide Medicaid funding for doula services. Studies comparing rates of preterm birth and cesarean delivery in Minnesota to national numbers suggest significant cost savings associated with implementation of doula insurance coverage. And if you'll permit me, I'll direct myself briefly to the fiscal note that was submitted regarding this bill. I appreciate the conscientious work of the Budget Office. I would say I actually take exception a little bit with their methodology for that assessment.
Okay, let's stay with the bill. What we're not going to do is get into a debate on the methodology, and that's not helpful for us at this point. So,
well, that's fine. I guess perhaps what I'm trying to express is that I believe that cost savings is still a reasonable expectation of this bill, as Representative.
Okay, and so if you make that point, then we have that. What I don't want to do is going to if you're going to disagree with a report, just say I disagree with the report, so that we can have everybody else get a chance to testify.
Fair enough.
That's
fair
enough.
All so I disagree because the study from Minnesota was specifically looking at a Medicaid population. And so the expectation that there would be a stronger effect in that population, that doula support may provide additional benefit versus an overall population, I think is a reasonable one. In short, doulas are good for patients. They improve obstetric outcomes, may help to address disparities in maternal health, and they provide critical support to new parents. And as a result of improved patient outcomes, insurance coverage for doula services has been shown to be associated with cost savings. Rhode Island ACOG strongly supports passage of H5609, and I personally look forward to seeing more of my patients have access to doula support.